Hi everyone. I am going to walk you through the complete documentation of a trauma patient with our new trauma MPage, and hopefully this will be helpful to all of you in the future. So basically with this new MPage, you can kind of start up here in the left corner and just work your way clear across the screen to the right hand side. So let's just start with a patient brought in by ambulance with a gunshot wound to the abdomen. So we're going to do trauma details first. This qualifies as a level 1 trauma, so we're going to go ahead and just set our time as now. We're activating a level 1. Yes, trauma team was activated. And our dosing weight, we're just going to go ahead and put in the same thing that was entered up here before. If it's different, you can enter whatever you need to enter in here for the dosing weight. Sign that. Now we're going to move down to our mechanism of injury. So this patient came in ground ambulance. He's an adult with a gunshot wound. Handgun at close range. We have no idea what the caliber is. Skip it. Is there an entry site and an exit site? There's a hole. There's only one. We're gonna document an entry site. And if you notice, it's not going to let you manually put anything in here because further down the line, we have this body map over here where we can document the location of the gunshot wound. So we're gonna keep on trucking. Mechanism of injury, it was an assault. And then the rest of this MVC stuff, it wasn't an MVC. You don't have to chart that. Close it. Keep moving. So we're going to move down to the evaluation and treatment. Pre-arrival, let's say they did a field dressing and IVIO insertion. And we'll leave it at that. So we're going to call this patient a patent airway, but we put them on nasal cannula. And when I click that nasal cannula, it pops up this option here for me to enter a flow rate. So when they were on the ambulance, they had them at 2 liters. Pre-arrival, the respiratory rate was reported to me as 20. There was no loss of consciousness. They didn't give me this pre-arrival, so not going to document it. They did give me a GCS of 15. Here in the mental status pre-arrival, they told me that the patient was alert and oriented ×4. You'll see I don't have that option. If you want to enter that, absolutely. Okay, IV insertion. Let's say they did an IV and they have 1 number of IV accesses. They put in 1 IV for me. No IOs. They did give a ½ liter of normal saline. They dressed the wound. They controlled the bleeding. And they used some direct pressure. Close it and keep moving down. The law enforcement, this patient, none of this is applicable currently. Go ahead and say no, they're not in law enforcement custody. Close. Now, I have all of this complete. Make sure we sign it. Okay. Now notice that it's going to say up here, 5 items missing. Those are those things that I skipped because they were not applicable or I didn't have the info. It's okay. It's not going to affect anything right now. So keep moving. Now we go over to our primary survey. So the patient on arrival is alert and responsive. Airway is patent. I don't remember if I said we put a collar on them, but sure, we put a collar on them. So we put a rigid trauma C collar on. Skin description. We can call them pale. Let's do that. Say they were pale. You can also see that there's not really an option here to document, you know, in our iView band, it says normal for ethnicity, I believe. There's not that option here. So if there's nothing here for you to document that's abnormal, don't document it. Okay, skin temperature, we're going to say cool. Here's your color, normal for ethnicity. You can say that. We said pale, cool, normal for ethnicity. Airway obstruction, moving on. No airway obstruction, so we did say C color though, so I'm going to mark this cervical spine stabilization. But other than that, we're going to say none of this. Airway interventions, no need to do any of that, none. Oxygen therapy, we said nasal cannula, and we did document in the pre-arrival info that the patient was on 2 liters. There is no option to document that here, but I will show you in just a little bit where you can document that. Moving on though, tracheal position is midline, respiratory effort is normal, chest motion symmetrical, chest exam normal. We don't need to worry about any of this. There's no chest trauma. Lung sounds, we can say clear in all lobes. Gross hemorrhage present, nope, we said ambulance service controlled the bleeding for us, so no. Gross hemorrhage controlled, it was pre-arrival and we already documented that. Heart sounds, here also, this is another spot where there's not an option to chart a normal heart sound. I believe that there are some changes coming to the MPage, and that was one of them that we talked about. So that will be in there eventually. Cardiac rhythm, we're going to say they're normal sinus, and we are assessing carotid pulses. And we are going to say that they are normal. Now let's assess the femorals as well. Normal femoral pulses as well. Perla, yes. We're going to say that is completely normal. Disability, neurointerventions. So we're thinking about our ABCs. D is disability. You know what? We're not worried about his neuro status right now. We don't need to do any of this currently. So patient environment and exposure, we removed clothing for sure. We went ahead and did some warm blankets, and we're going to give them some warm IV fluid. And family present, let's say they're not here yet. Okay, close. Make sure you sign this column. Again, it's going to tell us that there are items missing. We skipped over some, they were not applicable. Let's move over to the full assessment. This is your secondary survey. So, starting with that head-to-toe assessment, head-face trauma evaluation, no injuries to any of those areas, no eye problems, pupils, we already said were good, regular, brisk. I don't know, I didn't have time to get an estimate of that pupil size. It's okay. Skip it. Left eye, same. No symptoms, regular pupil, and brisk reaction. Nasal evaluation, there was no nasal trauma, so no nostril symptoms. Nasal drainage, they don't have any. I'm not going to mark anything. Ear trauma evaluation, no injuries, so no symptoms with the ears. Any bruising behind the ears? No, neither one. Okay, so oral trauma next, no injuries there. Teeth are normal. This is where we are documenting our neck assessment we have been drilling for a while now. All you have to say for that neck assessment, if it's There's no neck pain, there's no neck injury, no injuries noted. C-spine evaluation, they're not having pain, denies pain. C-spine precautions, we had the C collar on. We took it off, the doc cleared them. We can just go ahead and say C-spine precautions removed. There you go. There's your neck assessment. Okay, move on. No chest injuries, abdominal trauma evaluation. We have a penetrating wound. We're going to say belly's distended. It is absolutely tender. Tender in all quadrants. It's right in the middle. Bowel sounds. So we can say present in all quadrants. If we want to get a little deeper into that, say details assessed over here. And then you can document each quadrant individually. So let's say they're normal, except in the right lower quadrant. We're going to say hypoactive. Just for fun. Okay, so no pelvic trauma. So we're going to say no injuries noted here. Pelvis, we pushed on it a little bit. It's stable, good to go. No trauma to the genitalia. Urine, we haven't put in a Foley catheter yet, so you know what? If I don't know what that urine looks like right now, I can always come back and add that. I'm going to skip it for now. Rectal tone, the physician will be checking. If they do, let's say that the physician checked it and they said it was normal. I'm just going to say normal here. Extremity evaluation. No trauma to the extremities. It's just the belly stuff. So we'll say no injuries noted. Pulses assessed. We said that we looked at the carotids and the femorals. We also looked at the dorsalis, and they were all normal. So that popped all of those up for me bilaterally. Now I can just go through here and say all were normal. Then our cap refill, we're going to say is less than 2. Extremity tone, all extremities, and it's going to pop all of them up for me all the way through. So no abnormalities here. All extremity strength. So we're going to say extremity strength is normal. So full strength on all 4 extremities. And then movement, say all extremities. And we will say that is normal as well. So purposeful movement, sensation, all extremities, intact, all the way around. Back trauma evaluation. We did not notice anything on the back. There is no wound on the back side that might indicate that the bullet has come all the way through. So we're just going to say no injuries noted here. And close. And now our secondary survey is complete. We are going to sign that. Again, we are missing items. It's okay. So up here, you can associate to one of the monitors in the room. Just pick the correct one and say start. Easy as that. Or you can manually add. Click the add button here and notice it gives you 3 different tabs, and you can change your time as well if you need to back time. So you enter all of your vitals in here. Let's just enter a set, temporal and monitored systolic and diastolic blood pressure because we have him on the monitor. We're going to say he's 95 over 65. Heart rate of 110. Peripheral pulse rate, I didn't assess. Respiratory rate, 22. Oxygen is 100%. Okay. Pain level. He's given us a 10 out of 10. Okay. And GCS. Still a 15. Sign it. Okay. Now you're going to move down to your interventions. So this is where we're going to put in our IVs and lines and tubes and all that. So We said oxygen therapy. We had him on nasal cannula. We did some warm blankets. We did a peripheral IV. That's all that we have done to this point, okay? So then say apply. Now you have to go in here and click on these to actually document on that intervention. So let's open our oxygen therapy, and then you have to say add result at the top. Nasal cannula. And this is the only spot that I found so far where I could document. I just put in 2 liters here. Otherwise, just go back to your iView band and put it in your vitals, same as you normally would. Go ahead and sign. Let's document our IV. So we put in a left mid forearm for the needle, 18 on the ambulance. Yep, set now. We can go back and change the time because this happened, before when they were on the ambulance. Okay, and then go ahead and sign that. And then our warming and cooling results. So we did warm blankets. And these would be more for our actual devices for warming. So then if you come on down a little further, the patient response to warming, cooling, you can type something in here if there's a note that you want to make. Otherwise, I would just say expected under the procedure response. Okay. And then, nope, we're not treating hypothermia. Sign. And there's that. So we can also add orders from here if we need to. You can do a new order entry. You can chart these things from here, your triage 1 and 2, just like you would from LaunchPoint. If you click the barcode here, it's just going to open your medication administration wizard, so you can document meds from right here as well. If you click the MAR button, it would take you out of the trauma assessment and into the MAR over here in the menu. Just keep that in mind. So then, don't forget this. Then we have to come over here and look at these buttons on the far right side. So the first couple are kind of duplicates. This button, this orders, will do the same thing as clicking the add button here. Okay. If I click that, it looks the same. Same with this one. This is your interventions. It looks the same as when I clicked the add button here. Next one down, your body map. So this is where we would document our wounds. This person only had one in the belly. You could add more than one though if you click this multiple location mode. We're just going to say single location mode, and it was right in the middle but in the right lower quadrant. And gunshot. Okay, apply. Gunshot wound. It's labeled. Okay. Next one down is your consults. So if we are consulting these folks, and if you look at this list, it is not the list of people that we are calling for our trauma activation. These are specialties. So this would be a good time to chart these things. Probably not going to do a lot of these consults though on these trauma patients. So the next one down is your patient movement. The thing I want you to notice about this is I can say the patient was taken to x-ray right now. Then I can say that they were brought back to the ED right now. But then if I say they were taken to CT or ultrasound or MRI, following them coming back from DI once already, then I can't also document when they returned from there. So just keep that in mind. You can also document here the trauma equipment that goes with the patient. Patient went over with their oxygen and the cardiorespiratory, they went over on the monitor, and pulse ox. And none of the rest of this stuff, so we're good. And this we're going to bypass. We're going to leave it at that. Sign it. Next button down. This is the attendance of your trauma team, basically. This is not where we're going to document what time they were called. We don't have a spot for that currently in the MPage trauma documentation. So the date and the time that we've called these folks still has to be documented over here in your interactive view, your iView bands, for now. This would be to document when they actually show up. So I've been told it doesn't really make a difference where we click, whether we're clicking the attending or the resident. Either way, we know that this was the trauma physician and this is when they checked in. So we're going to say Dr. Sawyer, and this is when she arrived, and the anesthesiologist, and who else is on here? If pharmacy came down. And RT came down. Oh, she didn't pop up. Oh, here, I'm typing in the incorrect last name for her. Let's say here, and our rad tech. But you get the point with this. If there's one here that you can't find, you do have the option to add the additional role here. You would select other in the drop down, and then you can enter whoever this might be. So I'm going to put in here the house supervisor. Okay. And date, time, name. Sign. Okay, and this is the thing that we have noticed that people continue to forget. This looks good right now. It's all here. If you wanted to add any extra notes, you can do this, add narrative. Put a little extra note in there. All of this info that you have charted in the MPage, though, will not just automatically flow into a note in your notes section over here, and it will also not flow into your iView band until you have hit this button over here that says launch note. You have to do that. Click that launch note. Okay. It compiles all of that into this handy little note. You sign it. You get the green check mark. Now that note will be here in your emergency documentation. And info will have also flowed into your iView charting. Okay. And there it is, folks. There's the trauma documentation. If you have any questions about this, please feel free to reach out to myself or Julie Warner or our Cerner folks.